I am Whitney Vinson. I grew up in Nampa, Idaho. I went to Skyview High School, so go Hawks. After high school, I went to college in Texas and then med school in New Orleans, and most recently, I completed my dermatology residency at Indiana University. So I did 3 years of training under the experts of dermatology there, and I'm very excited to join Ada West now that I've completed my residency. I went through medical school and really loved every rotation I did. There was so many things about each specialty that I enjoyed. And dermatology kind of integrates all of those things. So I get to work with my hands and do surgical procedures. I also get to see patients in a more clinical setting and treat patients with medicine. So dermatology was kind of a sum of everything that I enjoyed about other specialties. So I just completed my residency, which is great. In residency, there's lots of learning, lots of conferences, lots of just day-to-day education. But I definitely would continue that as I go forward. I really enjoy listening to some different podcasts about dermatology, some of which are published by the Academy of Dermatology. I also enjoy reading the journal articles and then staying up to date with what patients see I think is important. So I do follow social media and try to keep up with some of the trends that patients are seeing so I can at least be educated and know what's going on. So to look for a dermatologist, I think the most important thing is find someone that you're comfortable with. So either be that you're very comfortable with how they were trained, or when you go to see them, you feel like they're listening to you and that you're comfortable with how they're explaining things. Overall, I think coming to a dermatologist can be a little bit vulnerable. You know, our skin checks, we often have you undressed and we're looking you over and we're having delicate conversations about how you feel your skin health is. And so if you find someone you're comfortable with, you'll keep coming back. Who should see a dermatologist? So that's a good question. Anyone that has concerns about their skin health, we're happy to see them. We see people as young as newborns all the way up to over 100 years old. So any age is appropriate. And then beyond that, I think it's very important for anyone who has a personal or family history of skin cancer or has had a lot of sun exposure in their life. I think that when you're looking for a dermatologist, especially a dermatologist physician, that it's important that they are a fellow of the American Academy of Dermatology, which means that they've passed their board certification exam as well as completed a residency specifically in dermatology. So one myth that never seems to die about skin health is that you only need to wear sunscreen if it's sunny, which is partly true. If it's sunny, I really think it's important to wear sunscreen. But us just looking outside to determine if it's sunny really doesn't give the full picture. Actually, there's something called the UV index, which I'm a big fan of. It's a standardized unit of how much UV radiation you would get from the sun when you're outside at a given time. The great thing with modern phones is that most weather apps have the UV index on there, and you can use that to dictate how much sun protection you need, or if it's a time that's best to avoid just being outside. I generally practice if it's 0 to 1. I know this is maybe unpopular opinion, but you don't particularly need as much sunscreen. If it's higher than a 1, then you would want to have sunscreen. And when it gets to those really high numbers, like an 8 to 10, I recommend avoiding being outside and seeking shade as much as possible. So I wish that patients understood all of the options there are for sun protection as well. I think we tend to have that image of zinc sunscreen being a white sunscreen that you can't rub in. But nowadays there are so many other options. So there's sun protective clothing where the fabric's actually treated with a chemical that makes it more sun protective. There are so many zinc sunscreens now that rub in. I'm wearing one right now, you can't see them. And beyond that, there's things like tinting your windows so that you don't get additional UVA exposure, as that does still travel through windows. So sunscreen, just like skincare, is very personal. I think you have to find the one that works for you. Generally, for full body sunscreen, I have a lot of success with the Blue Lizard brand based out of Australia. I also really like Elta MD. And then for face sunscreens, more and more data is coming out that visible light does affect hyperpigmentation, which a lot of patients are bothered by. So I do recommend a tinted, which has generally iron oxide, mineral-based sunscreen, so then a zinc or titanium with the tint. So something I have pre-medical school done very not correctly with my skin was that anytime I got a cut, I would use a triple antibiotic. You'll find when you come to a dermatologist that we are not big fans of the triple antibiotic, specifically because there's a lot of data that patients can become allergic to the ingredients of the antibiotic, that if you're applying it to your skin frequently. And then beyond that, most cuts don't need it. Even if you see a little redness around a cut, that doesn't mean it's infected. a dermatologist is always happy to look at it and make sure that it doesn't have signs of infection, but often just a little Vaseline is going to have just as good, if not better, results than a triple antibiotic. So I grew up in Nampa, and now I'm in Southeast Boise, and I am loving being so close to the foothills. There's amazing parks, it's very family friendly, and overall the people have been unbelievably nice.
What's your favorite Idaho activity or event?
So my family, we really like hiking in the foothills. I have a 2-year-old, and he absolutely loves getting out on the trails. He goes between a 40 and an 80-minute mile, so we're not going very far, very fast, but he loves it. Our probably easiest health practice that we do as a family is that every lunch and every dinner there is one vegetable on the plate. I've actually started that since I've had children, just to try to really introduce it more, and I think it's been really great for both my husband and I too. We've explored new vegetables, and it's kind of forced us to have a goal to always have something on the plate. So advice that I would have given myself at age 15, so I would have been a freshman at Skyview High School, and I would tell myself to appreciate Idaho more. So as soon as I graduated high school, I went off, and I've been gone for about a decade, and now that I've come back, it has just been eye-opening how great the foothills are, how great Boise is, the surrounding area, and how nice the people are. I think growing up here, I took it for granted. So if I wasn't in dermatology and medicine in general, I think I would still want to do something that I can work with my hands. It's something I really enjoy in dermatology is the surgery part. So something I can work with my hands and be artistic. I've always been really into like cake decorating or clothing design, something of that nature. So one of the first jobs I had was I gave horse riding lessons. Growing up, I actually competed in rodeo, so I was always around horses. And it was kind of my first experience talking people through things that they're afraid of or uncomfortable experiences, and now it lends very well. I understand that we do biopsies day in and day out, and to me it's a very normal thing, but for some patients it'll be their first biopsy ever, and it's a very similar experience talking them through that. If I were going to describe myself in one word, I would say I'm a mom. So I have 2 beautiful little boys, a 2-year-old and a 2-month-old, and I think being a mom has made me a better doctor. I know everyone says treat patients the way you would want to be treated, but I actually try to treat patients the way I'd want my kids to be treated, and I think it's just another level of appreciation. Something that always surprises people about you. So during my first pregnancy, when I was 8 months pregnant, I competed in what's called the Tour de Donut. So it's a 34-mile bike ride, and for every donut you eat, you get 5 minutes subtracted from your time, and so there's a donut adjusted time winner. And yep, I'm trying to remember, I think I ate 12 donuts that day, 8 months pregnant, and did the ride, and it's something I'm very proud of. So a lot of patients want to know about makeup wipes, and unfortunately not all wipes are created equally. Many wipes will have fragrance or other components that are common allergic contact allergens for patients, so you can actually have an allergy to the wipe you're using, can be quite irritating. The frustrating thing about allergic contact dermatitis is that it's slow. So you're not going to use the wipe and instantly have the effect. It's going to take a couple days, and it can be very hard to determine that the wipe is the problem. There are some makeup wipes that are a little bit more sensitive on the skin, and they don't have some of the traditional contact allergens. Those would be the ones I recommend. And as a makeup wearer myself, I understand the importance of having a wipe and not always using your towels. So it's just finding one that works for you. So a lot of people ask about pore size and how they can help prevent clogged pores. Unfortunately, in the dermatology world and just in general, there isn't a ton of actual clinical data or studies on this. It's not something that's widely studied. It's not something that's going to be particularly sponsored by any universities or pharmaceutical companies to look at. That being said, you can do things to improve the appearance of your skin, like using salicylic acid. Some people find improvement with retinoids, over-the-counter retinol, and then also prescription strength. But I think the best thing would be to come into a dermatologist, let us figure out what it is particularly about your skin that's bothering you or that's giving the appearance of large pores and what we can do to help.